Hi, I'm Chloe Dean, and this video is for Communication 325 for Janelle Willis. This book we're using is Interpersonal Relationships by Arnold and Boggs, 2011. And I'm going to be talking about listening responses. That's found on page 185 as tables in dash 1. I use minimal cues and leads, so that would be nodding, leaning forward, or words such as mm-hmm or uh-huh. And clarification, which would be asking the client, can you describe what happened, so they tell it back to you in a sequence. A restatement would be asking, are you saying, and then a quote of what, or a paraphrase of what the client is saying. Paraphrasing would be saying back in different words what the client is saying to you. So it sounds as though you've had enough when the client specifies or states that they're not feeling well. Reflection would be, it sounds as though you're feeling guilty, or another emotion that you put to the client's description. And silence and touch both are nonverbal, but they're also indicators of listening. Like briefly, silence would be briefly disconnecting, and then touch would be maybe touching your arm or such, so that they realize that you are listening and responding to what they're saying.
The scene you are about to see is a nurse talking with the friend of a client, and the friend is very worried and upset because the client had been in a car accident where she was also in the car, and this video is about how the nurse listens and responds to what the client's friend is saying. Knock, knock.
Yeah.
Are you all right?
No. Yes. I don't know.
Do you want to talk about it?
Well, okay.
Why don't you tell me what happened?
Well, Anna and I were going home from Town Square where we were hanging out with our friends, and we were fighting in the car, and we got into a car accident.
Go on.
She's been acting differently lately, and that's why we were fighting. I was yelling, and she was yelling, and the next thing we know, we're in a car accident. Her leg was crushed, and I just got a few scratches, and I feel bad.
It sounds to me like you feel guilt for what happened.
Well, yeah. I mean, she's not even awake, and I'm walking. If we hadn't fought, we wouldn't be here at the hospital right now.
Well, I'm sure she doesn't blame you for it. When she wakes up, I'm sure she'll be happy to see that you've been here. And right now, she just needs to know that you're here.
But I can't just wait anymore. I need to know she's okay.
It sounds as though you're saying you've had enough.
Well, yeah, I have. I'm worried.
Well, you've been here for hours. Maybe you should just go home and we'll give you a call when she wakes up. And it's been a long night. I'm sure you'll feel better after.
Okay, I'll call someone to pick me up.
Okay.
Thanks. Hi, my name is Katherine, and in this next scene, you're going to see some conflict resolution strategies from Interpersonal Relationship by Arnold and Boggs. In this scene, you're going to see me manage my anxiety. That's when I take the time to cool off, take deep breaths before returning back to a stressful scenario. Next, you're going to see me asking my patient for a behavior change. That's when I ask them to change their behavior assertively because either they're not being polite or they're not following the rules. Next, you're going to see me do some active listening. That's when I take the time to listen to my patient's explanation of why they're acting that way and listening more than talking. Also, finally, you're going to see me taking one step at a time. That's when I handle the present issue rather than thinking in the future. Okay. In this next scene, you're going to see me, the nurse, dealing with an NPO patient who's waiting for her procedure and her doctor's late, so she's a little bit irritated.
Nurse!
Hi, yes.
Where is my doctor? He was supposed to be here at 7 o'clock, and I haven't had anything to eat since last night, and I haven't bathed in 3 days. Why aren't you doing your job? Why didn't you call the doctor?
Okay, I'll call your doctor right now and see if there's been any changes. Is there anything else I can do for you?
No, just go.
Ow! Just take a deep breath. Okay, take it one at a time. Call the doctor. Hi, doctor. Okay, bye. Knock, knock. Mrs. Gilbert, I know you're feeling upset right now, but it's not okay to throw things on the floor or at people. This could be a hazard for you.
I understand. I just got so angry, and I don't know what came over me.
Well, what made you so angry? Do you want to talk about it?
Well, it's just I didn't eat since yesterday, and I wasn't able to take a shower because of this heart monitor, and I started thinking about the future, and it makes me afraid. I don't know what's going to happen, and I don't feel like I have any control.
Okay, well, I understand what you're feeling, but let's try to take things one at a time. Stick to the present. Right now, I called your doctor. He said he'll be in an hour. And I know I told you that you couldn't take a shower, but I could assist you in a bed bath if you'd like. I know you haven't been eating longer than you expected, but that's all I could do for you right now. Would you like me to go get the materials for your bed bath?
Okay, thank you. That would be great.
Okay.
Client, if they could restate, if what you asked is.
Yeah, I feel guilty.
Go on.
I don't know what else.
Managing or